Date. We're here at the City of Show Low. On the phone, we have some special guests. We have Dr. Marie McCarthy, Chief of Staff of the Phoenix VA Health Center, along with Dr. Felipe Gutierrez, Chief of Infectious Disease. In person here, we have Stephanie Ray from the county. Thank you, Stephanie. You're in charge of workforce and economic development. And Jimmy Applegate. Grateful to have you with us today here from the Chamber of Commerce.
You bet.
We want to thank our citizens who might be watching or joining with us here or will see this on a tape. We're just thankful for everybody, what you're doing here, the patience that you're showing. I know there's a lot of changes that are happening, but we're grateful to report that we do not have an active case in the City of Show Low. We do have about 53 cases in Navajo County. Most of those are contained in the northern part of the county, but we have had a spread to Winslow. And so we just encourage our citizens to continue to do what you're doing, continue to take preventive measures, and if you can even take a little more preventive measures. I know a lot of our businesses have closed to face-to-face traffic. They're doing virtual business right now. So on the phone here, we have Dr. Marie McCarthy. Why don't you share with us a little bit about, from the veterans, some of the things that they can expect, some of the things that you're seeing with this disease, and what we can expect help and aid from you guys, what you see. Thank you.
Thanks so much for inviting us to be part of this. I think it's so important to get the word out and to have as much communication as we can. As you know, we're honored to serve quite a number of veterans who come to our clinic in Show Low, and things have been changing somewhat in the clinic. As a healthcare system, we're trying to keep as many patients from coming for face-to-face visits as possible. VA as a whole has expanded the use of both telephone and what are called video connect visits. I know that's a challenge for people that might have some internet connectivity kind of challenges, but this is a kind of opportunity. VA had a more clunky method for connection, and with this outbreak of COVID, we've been given some leeway nationally to be able to use FaceTime and Skype and Google Chat and other means for veterans to be able to connect with us if they have internet access. So if they were to come to our clinic, what you would see is that there is a screening area at the front door, and they'll be asked questions like if they have a fever or if they have a cough or if they've been exposed to somebody who is known to have had a COVID. And so they will hear from the staff what the next step is based on their answers to the screening questions. Some of the normal things that veterans come to the Show Low clinic to get include like ID cards and so forth. But at this point, what we're trying to do is keep the clinic as simple as possible. It's not like we don't want to treat veterans, but we want to keep them healthy. And sometimes the best way to do that is to prevent exposure to others as well. I know Audiology they're doing a nice hearing aid walk-in, and what they're trying to do that just at the door without people coming into the clinic. So this is not business as usual for us or for most other healthcare systems. And what we're trying to do is make changes that can help keep patients as safe as possible.
Well, we certainly appreciate that, because I feel that that's definitely something that we're all learning a little bit about. Telemedicine is something that I know is going to be covered by most insurance policies now. And so as things change, but I think our veterans are the people that are probably a little more high risk as some of this disease. So whatever you guys have done, I sure appreciate basically what you've done to keep them safe. Dr. Felipe, do you have some more that you'd like to share about this disease, or how we can continue to do what we're doing to make it better?
Sure. So as everyone knows, it's a disease that is now widespread worldwide. And here in the United States, we lead the world in a number of cases. What we believe is that a principle that we can apply with ease, and at least to some degree, is that of social distancing. That we know that when we've done this, that we've seen that the peak of the number of cases don't peak quite as high. We know that most people who get infected will do fine. Some people might have more moderate disease, but there are unfortunately those that will have very complicated courses. And unfortunately, those are the folks that that are already suffering oftentimes from other medical ailments and pre-existing conditions. So I think that my recommendation would be to people, number one, is to really be cognizant of where your hands are. Wash your hands frequently. Don't touch your face. It's one of those things that we do so automatically, but this is a time for us to be thinking about those things. And then that social distancing does make a difference. At least if we could do it for a while, we could make a difference and prevent further transmission, because that's really what we're trying to achieve, is prevent transmission from one person to the other. This is a disease where we don't really have treatments. We give what is called supportive care. And so we're just trying to, send the message out that the social distancing, the hand hygiene are probably the two primary interventions that we can all undertake that really do have an impact.
Thank you. It's my understanding that if you get some of these symptoms or some of these things that are going on, it's not really going to be necessary. You don't have to be tested positive in order to treat. You'll continue to do the same things as if you had a regular flu. You'd try to hydrate yourself. You'd try to keep yourself away from others. And only as those conditions, if they worsened, if you had a fever and then that fever continued to increase, then at that point you should maybe go to the hospital, or if you started having respiratory problems, then you should go to the hospital. But if your symptoms don't worsen, you're putting yourself as much risk and others at risk by going out and mingling. But we need to treat it similar to any other sickness that you'd have until it progressed to a point where you'd need to be hospitalized. Is that kind of a correct analogy as well?
I could not have said it better. Absolutely true. If you are feeling ill but you're otherwise okay, stay at home, and care for yourself. But you're right. The more that we are out and about, the more that we'll either likely, get it from someone or give it to someone. And so, if there is no real reason for you to seek medical care, then stay at home. Absolutely, Mayor. Well said.
Thank you. Is there anything else that either one? I don't want to hold you on hold here on the phone all day, but is there anything else you'd like to share to the public, either of you?
Well, especially for our veterans, we want them to know we care about them. We want to help them. We do have a call center which can answer their calls. I know our Sholo veterans like to call the clinic directly. There are staff in the clinic that are there to help them, but know that we're here for them and we do want to help them. Thank
you very much. Dr. McCarthy, thank you, and Dr. Gutierrez, thank you so much for being on our show today.
Mayor Seymore, thanks for inviting us.
And may you guys stay safe. Thanks for all you're doing. Appreciate it.
Thank you. Bye now.
Stephanie, share with us here as the director of the Arizona workforce, and everything's going to change as far as unemployment, as far as resources that we have going forward. Just share with us. I know with this stimulus bill, that's going to be a lot of learning and understanding. Take us through some of the things that right now that we can count on and know what's going to be there.
Sure. So one thing that we need to talk about is, what do we do with these, what do these job seekers do? What do these employees do that have been laid off of work? And so the governor actually signed an executive order last week that made some changes to unemployment insurance. So anyone who is out of work because of COVID-19, it could be that their employer has laid them off. It could be that they're caring for someone who is sick. It could be that they are under a stay-at-home order. They are eligible to apply for unemployment. They used to have to wait a week. They had to be out of work a week before they could apply. This executive order has changed that, and so they're immediately able to apply for benefits. They also, so there's no waiting week. They don't have to do work search requirements. So generally when you're on unemployment, every week you have to go do X number of applications, put in to show that you're looking for work, that you're available for work currently, those requirements are no longer there. And so if we're having to stay home, we can't go to work, people can still access those unemployment benefits. Made some changes to qualification requirements. And one thing that, the CARES Act, as you said, we're still kind of parsing through what that's going to mean. But that does also allow people who previously would not have been eligible for unemployment, self-employed, people who work as independent contractors, part-time employees, people with a shorter work history, they may also be eligible for benefits. And so it's real important right now, if people are out of work and they're not sure what to do, they should go on and apply for benefits and see what they're eligible for.
That's great. And it's a website where they can go online. Are you familiar with that, or is there something coming?
It is. And so there's an 800 number, and I know last week they had such an influx of calls that it did crash the system. They've added staff, they've extended hours, they're open, the call center's open from 7 a.m. to 7 p.m. But if people have internet access, they can go on to uiclaims.azdes.gov, and there's an online application process that they can go through. And then if they do have issues, so we're recommending that they first go to the website if they have internet access, do the 877 number as a backup. If they don't have internet access, of course, we're recommending the 877 number. Our job centers are still open, but we have gone down to less staff, and they're kind of rotating, working from home so that they can remain according to those social distancing protocols. And so we're able to rotate less people through the job centers. And so we're really recommending for people to utilize that 800 number and the website to apply.
Okay. Mr. Applegate, share with us a little bit about some of the things they're struggling here. Some employees, are out of, work just because some of their businesses have been shut down. What are some advice or some things that you're finding that can help here from the Chamber of Commerce and some of the things that you've, have going on at this time?
Mayor, I've spent the last couple of days contacting local businesses in the Shiloh area and just talking with them, asking them what they need and how they're doing and how they're holding up. Believe it or not, many of them are very optimistic and positive, and it's been a relief to hear the optimistic sound of their voice. But some of the questions that they've had probably surround around a question if they should be open or not. And so we're directing them towards the executive order from the governor to help us understand a little bit better about what an essential business is or service is at this time, so that'll help them better assess and judge if they should be open or should not be. And that seems to be one of the main things that they're looking for. And of course, the other questions that they have are the ones we don't know yet, which is the how long question. And so we're obviously feeling through that. But we're taking our time to really get this information out. Stephanie mentioned a minute ago about some of the things that have come down in the stimulus package, and of course the SBA loan information. We've got that out there. And so those questions are starting to come as well as to how do we do it, how do we apply, how do we get more information about it. And so we've got that sent out there as well. But certainly we'll love to field more of those questions and get the information out there.
Great. Stephanie, do you have anything on a website that you want to talk about or go through today?
So we haven't set up a website outside of the Navajo County az.gov/coronavirus. We do have a resource library on there for employers. One thing that we have set up, though, for employers who have questions is an email address. It's employerhelp@navajocountyaz.gov. We really want to make sure that we are starting to address those questions that employers have and being able to answer those that we can now, and then also, as we understand more and more about the stimulus package, help guide them to resources. We do have programs that are available now. If employers are concerned about laying off employees, there are some shared work programs that we'd love to help connect them to that could allow them to keep their employees on, reduce hours, and then the unemployment system actually will come in and supplement those employee wages. And so they're able to keep everybody working, but it's reduced cost to them, help them to stay afloat during this time. And so we really would love to have questions into that email address. We're going to be sending out some surveys to businesses to really understand what their critical needs are so that we can address those. We're talking about some email blasts, doing some webinars and those kinds of things, but we really want to hear from the businesses. What are your critical needs right now? What is the information you need from us? And then we can prepare that information and get it disseminated out.
Okay. Some of the things that have been asked of me, mostly from the restaurant business, a lot of the restaurants have been closed here or just to take out services, but yet they see that the grocery stores are still open and people are bumping shoulder to shoulder. We really encourage people that when you go to the grocery store to exercise some really self-discipline. I'm a hands-on guy, so I like to touch everything. Well, my wife told me, I can't be touching everything. So we need to be careful that we don't touch until we're ready to purchase or grab it off the shelf. We need to still exercise that social distancing while at the store. We cannot close a grocery store. That's the essential thing that has to stay open. Where some of the restaurants, it was the governor's order to close that, where there was a case in our county. We've also had another county who does not have a case in their county, but they have started closing those same things, the restaurants, the gyms, the theaters. So it's going to be real difficult for those restaurants. We encourage people to still call in, do some takeout orders, things that way to continue to help them survive through this time. Yeah, Jimmy, can you have a comment there?
And to that end, Mayor, we've gathered many of those restaurant names and put them on a Facebook spreadsheet. So Charlotte Chamber Facebook will tell you who's open at what times, when you can call on a delivery, when they can deliver, and when you can go pick up. Those hours vary depending on the restaurant. That you may or may not be used to their normal hours. They're going to change a little bit because of these closures, but they're still open for business, and they want you to know, hey, come and get lunch here, and just show up, pick it up, and head back out the door. And so we've made that list, and actually we're adding to that every single day, 4 or 5 restaurants throughout the White Mountain area. So,
right. I just received word today from Councilmember Leach, who's on NACOG, that NACOG received $497,000 so from the state. So there's some monies that are going to be trickling back down to our seniors as far as Meals on Wheels, things like that they'll be able to have extra monies for some extra meals. That is going to be very good. We're also waiting on the $55 million that's to go to health services. The state government is waiting to see what funds they will get from the federal aid, and not to put this $55 million somewhere where then they can't get the federal aid to duplicate. So we're just trying to get the ins and outs of this $2.2 trillion stimulus.
Right.
Now, one of the things that's going to help businesses, there is a grant. It's not a loan, but there is an emergency grant that you will be able to, you have to go in and apply for it through the SBA. And a part of it will be a loan, but there's $10,000 that will be forgiven. And so you won't have to pay that $10,000 back. So that's an aid that's going to help some of our businesses, as well as some of the businesses will be able to acquire some small business loans up to $2 million in some cases, and as high as $10 million in other cases that are a little larger. So once we try to stay ahead of the curve, we're going to try to stay ahead of the information that's required to get those loans and to be able to pass it out, disseminate it through you, Stephanie, and you, Jimmy, to be able to advise our businesses of what's available for them. So right now we know the money's coming. The state of Arizona is going to get about $2.8 billion. Then the county will apply for some of those funds, but we don't know what all the red tape is associated, and until we know all of the details, whether it's just going to be a reimbursement for costs you've incurred or if it's going to help for lost revenues, that's still unknown. So we just encourage you to continue to operate as best you can, as safe as you can. And this weekend is going to, I believe, a significant time in the numbers and things. We're going to learn a lot as we start to unfold some of these cases too. Do either of you have anything else you'd like to share before I kind of wrap up?
No, I'd just say if there's questions out there that businesses have and they want to get answered, certainly leave us an email at the Chamber of Commerce, info@sholochamber.com, or give us a call, 537-2326.
Thank you.
Thank you.
Definitely.
And I'll just once again, same thing, if you've got questions, employer help at navajocountyaz.gov, and look for some surveys that will be asking for questions, and we'd really appreciate responses to those so that we can help.
Thank you. As I've always asked our citizens, is to be kind, be gentle to those people around you, and especially your neighbors. Being most people that know me, personally know that I'm a man of faith. And at this time, I mentioned it on our show Tuesday, but I'm going to re-encourage our citizens to participate in a global fast ask our Heavenly Father and the Savior Jesus Christ that they'll help us. They'll help us at this time of need, that we'll be able to reach out in prayer and fasting, and if we'll all join with that on Sunday, the 29th, I think it's a time that we need to realize that we need help beyond ourselves here. And pray for your leaders, pray for those people who have to make decisions, that they'll have understanding and wisdom beyond their own. And so thank you very much. We appreciate our citizens. We appreciate your care for one another. And we just hope that you'll remain safe and, you're a great law-abiding citizens. Thank you so much.